Well, for more on that press briefing, let's go to SABC's Chriselda Lewis. Chriselda, good evening. Welcome to the Full View. Starting off with what the Minister spoke about, of course, these 4 new confirmed cases. Does the Minister and the National Institute of Communicable Diseases see this as a positive sign in the sense that it shows that South Africa has the ability to track down people who may have come into contact with somebody who's tested positive with the coronavirus?
Well, Aldrin, the Health Minister, pointing out that it came as no surprise to them that these 4 additional cases now have tested positive, obviously because you'd know that this was a group of 10 people who had gone to Italy and had basically been in very close proximity to each other. So in the first instance where you had the first South African, of course, in Hilton in KwaZulu-Natal, who was traveling with the rest of those individuals testing positive, it was obviously very important for contact tracing to take place, the National Institute for Communicable Diseases, to ensure that the rest of the 10 people who were on that trip as well would also undergo the necessary tests. So the Health Ministry says, not really surprising, that number standing at 7 now, as you've indicated. 2 others were still waiting for the results at this point, and you would know that 1 other had basically travelled from Italy to the United Kingdom. So at this stage, we're still waiting the results of 2 of the other individuals. But Aldrin, I think it's quite important to point out at this time is that all these cases in South Africa now, all 7 of them are linked to this one particular trip in Italy. So in that instance, then the Health Ministry says there is no need to panic. All the necessary measures have been put in place to ensure that the virus itself is contained. They were able to put these or take care of these particular ones. And he says that at this stage they're quite satisfied with the manner in which they've been able to detect this virus in these 10 individuals.
Last week, we also saw, immediately after this case was confirmed, the 38-year-old man's case was confirmed. We saw the school that these kids go to send out an email to the parents saying that there won't be any schooling that will be taking place on the Friday, I think. And now today, we also know, we understand that Grayston Prep School as well has decided to suspend learning and teaching. But do we know what measures are being taken by the Institute of Communicable Diseases and these medical staff to check whether this disease could have spread to these schools?
Well, Aldrin, in fact, that is one of the questions that we did pose to the Minister, and I can sense a bit of unhappiness on the part of the Gauteng Education Department on the reasons that the school had on its own decided to suspend learning and teaching for today. That was certainly not a decision taken by the Gauteng Education Department. So basically, the Health Minister is calling for calm at this stage. What I do know is that this afternoon, there were a group of officials from both the Health Department as well as the Education Department that had gone to have talks with the school on what the possible way forward would be. Because what is being investigated at this stage is that it's believed that one of the teachers had come into close contact with one of the individuals who was confirmed to have tested positive for the coronavirus. But obviously all those tests need to take place. The National Institute for Communicable Diseases, though, confirming that none of the 7 that we're talking about currently, none of them is a teacher. So at this stage, they will look at all eventualities, but I can confirm that currently as it stands, none of the 7 are the teacher that we're talking about relating to the Grayston Prep School. No indication at this stage for how long learning and teaching will be suspended for. I'm sure we'll get a response to that in the next couple of hours.
Did the department touch at all around fears that have been created around people coming into contact with certain race groups? Because there is this perception as well that, since the epicenter of this disease comes from Wuhan and you have Chinese nationals, that Chinese nationals have been treated in a very derogatory manner.
Well, I've certainly seen quite a number of reports pertaining to that, Aldrin, but certainly not something that the Health Minister had touched on. But what he did, in fact, say is that he does believe, for example, if I could just touch, Aldrin, on some of the other important aspects that he spoke about, panic buying, for example. We know the SABC has been looking at quite a number of issues pertaining to the economic impact, for example, that the coronavirus outbreak is having. The Minister acknowledging that panic buying is not just taking place in South Africa. It is taking place around the world. I mean, if you'd walk into some of the health shops, you would actually find that in the aisles where you would have your hand sanitizer, most of those shelves are empty. You have most of these stores who are replenishing every single day because South Africans are going out and taking those precautions. The health minister is saying, look, it's not necessary to do that. Simply wash your hands as often as possible and you should be okay. So again, trying to allay fears pertaining to that. Very quickly, Aldrin, where we are here this evening, just a few moments ago, the tourism minister was meeting with stakeholders in this particular sector. You would know, of course, that the impact of this will be so hardly felt. You'd remember last week, the Deputy Finance Minister, David Masondo, had indicated that this coronavirus was certainly going to have a negative impact on South Africa's economy, certainly in tourism as well. That's why the minister herself has taken the opportunity to speak to stakeholders within the tourism sector. She indicating that already you can see the negative aspects. I mean, Aldrin, you talk, for example, about the G77, which was due to take place in Uganda. That has subsequently been cancelled. Some countries have put flight restrictions. South Africa not doing that at this stage. It was one of the key things that we thought would take to that media briefing with the Health Minister, Dr. Zweli Mkhize, whether South Africa would be considering at this stage to restrict flights, in particular from China and Italy, where you've got most of these reports coming from. But what we do know is that the Health Minister saying that Cabinet will decide on that. We're expecting some kind of decision on whether South Africa will change its stance, in particular to the flight restrictions that we've seen in other countries. I mean, you know, in Rwanda, for example, the Commonwealth, we want to see whether that's going to go ahead as well. So a lot at this stage riding on, South Africa's response to the whole crisis surrounding the coronavirus. But all sectors, certainly you can see the Health Minister this evening, it's the Tourism Minister, was trying to assure stakeholders within the sector that even though there is a significant impact already being felt as a result of these travel restrictions that have been put in place by other countries, South Africa is still looking at the situation currently. Cabinet will make a decision on what should happen next, but they're saying certainly no need to panic because all 7 of these cases are related to that one incident of the group of 10 people who travelled to Italy recently.
Thank you so much, Chriselda Lewis. And we also know that the department has indicated that they're also looking into those who may have come into contact with these 7 individuals. Let's move over to this story.